Good morning. This is Dr. McDaniel at GYN Corner. I'm a board-certified obstetrician gynecologist in New York City, Midtown Manhattan, and I'm bringing to you all things health-related for women. Thank you for joining me at GYN Corner. Today is Tuesday, September 24th. It's a gorgeous day in New York City, Midtown Manhattan. Let's see, yesterday was the first day of autumn, so I guess we're officially getting an Indian summer here because it's still warm. Yesterday I think it was in the lower 80s, and today it's in the, already it's 10:49, and it's in the, feels like it's in the mid 70s or so it's pretty nice. We'll cherish it while we can. So let's see, last week, I believe it was Saturday, so a couple days ago I spoke about PID, or pelvic inflammatory disease. It affects about 5% of the female population, and it's due to an infection that causes inflammatory changes and damage of the pelvic organs, predominantly the uterus, fallopian tubes, and the surrounding tissues. PID is predominantly a sexual infection, so chlamydia or gonorrhea, which are both sexual infections, they climb into the cervix, upper cervical area where the glandular or the plump endoglandular cells are located. They burrow into those cells, and if the conditions are right, they ascend into the uterus, out through the fallopian tubes, and into the pelvic tissues. Now, non-sexual ways, well, I guess one other sexual way that someone could get pelvic inflammatory disease, PID, besides getting chlamydia or gonorrhea, is having intercourse during the menstrual cycle or directly after the menstrual cycle, because the cervix is very, very tightly closed unless someone's ovulating or unless they're menstruating. So during and right after the menstrual cycle, the cervix is a little bit open, so it allows for fluids to go up into the uterus as well as out. And then with non-condom use with ejaculation, that pushes bloody bacteria, and bacterial levels are highly concentrated and elevated during the menstrual cycle because blood feeds bacteria. So they have high levels or concentration of bacteria in the vaginal cervical environment. Ejaculation swooshes all of that bloody bacteria back up into the uterus. It harbors, forms an infection, of course, because the uterus is a sterile environment. It's not supposed to have any bacteria there. And then it flows out once it's purulent, becomes infectious and pustular, flows out into the fallopian tubes and into the pelvic tissues to cause PID. So it's not due to chlamydia, gonorrhea, but it's still due to sexual activity. So even though I think most people know that you can't get pregnant when you're on your menstrual cycle or directly before or after the menstrual cycle that catches, it does have an environment that's ripe for potential infection. Non-sexual ways one can get PID is through douching. So using an apparatus with a tube that washes out the vagina. It has a bulb suction basically, so you're squeezing, forcing with the fluid into the vagina, and that force can potentially swoosh bacteria up into the uterus via a slightly lax cervix, either with ovulation, so mid-cycle, or directly after the menstrual cycle, because the cervix is a little bit lax or open. Another way that I have seen, I've had 2 patients who got PID by using over-the-counter vaginal medications. So, one was a prescription. I'd given a lady a prescription for a vaginal antibiotic, and it was a 7-day prescription. 3 or 4 days into the antibiotic, her menstrual cycle started. So, instead of asking me what she should do, she called a number on the back of the box, and whoever answers those hotlines for the medications, they told her it was perfectly fine to use the vaginal antibiotic during her menstrual period, which is what she did, and she got PID from that because, again, you're swooshing a little bit of force. Those medications have a little piston, so you're squirting the antibiotic into the vagina. You put it up as far as possible, which usually means it's right up on or close to the cervix. You're swooshing, pressing the piston, and with a little bit of force pushing that antibiotic up into the upper part of the vagina and the cervix. Well, blood again increases bacteria, and it's swooshed bloody bacteria up into her uterus, she got a PID. Another patient did the same thing with over-the-counter yeast preps. She bought one of those boxes because she was having irritation, discomfort before her menstrual cycle. The cycle started. She used the anti-yeast medicine anyways because she was uncomfortable, and she got a PID. So it seems obvious to me, but not everything's obvious. Thank you. If you are on your menstrual cycle, how is vaginal medication going to help? Because there's so much blood. If anything, it's going to overcome the effects of the medication, or it's going to wash it out. So those are two non-sexual ways: douching and using vaginal preps during or right after the menstrual, too close to the menstrual cycle, or potentially when you ovulate. And then sexual ways are getting chlamydia, gonorrhea, or having intercourse during or right after the menstrual cycle also. Signs and symptoms of PID. So the most common symptom is pelvic pain. So either pain with activity, pain with intercourse, pain with running, jumping, or pain if you press on the belly. So unusual cramping or aching or pain. Oftentimes people say it feels like menstrual cramps or like their period's coming, but they know it's not their period, and it's random. Or it's with activities or jostling or increased abdominal pressure. Another common symptom is abnormal bleeding. So spotting, brown, smudgy, what we call staining, or pink or bright red spotting, or light bleeding. So any kind of bleeding outside the menstrual cycle, that's a big clue that there may be an infection present. So whenever a patient comes into the office with any kind of cramping or pain outside of the cycle, and or bleeding, be it brown, smudgy, pink, spotty, bright red, or like a period outside of the menstrual cycle, the first thing we do is, as far as testing goes, once we know she's not pregnant, is we check to see if it's from an infection, either a bladder infection or a sexual infection, chlamydia or gonorrhea. If it's not due to an infection, but the pain persists, then I'll do an exam to see what kind of pain there is, and then an ultrasound or a sonogram to see if there's a physical reason for the pain. So any kind of bleeding, pain, or cramping outside the menstrual cycle is the most common signs or symptoms of PID. And then if left untreated, it will progress into fever, chills, and eventually, as it becomes more of an inflammatory process in the pelvic tissues, the inflammatory process produces liquid or fluid, and that liquid or fluid and the inflammatory process itself slows the bowels down. So bloating, nausea, and eventually vomiting occurs. So the most common symptoms are pain, cramping, bleeding, spotting or brown smudgy, and then fever, chills, nausea, and vomiting. Obviously, if you have pain or cramping that has you doubled over in pain, or you're taking pain medicine, or bleeding outside of the cycle, you should always seek medical attention. If it's accompanied with even a low-grade fever, which would be 100.6 or higher, you'll want to either go directly to the gynecologist's office for evaluation. If it's after hours, then you'll want to go to urgent care or the emergency room for evaluation. We check to see if it's potentially a bladder infection, kidney infection, cystitis, pyelonephritis, and if not, we check cultures and we do an exam and a sonogram to see if it's from an infectious process or something physical. So those are the signs and symptoms of PID. I'm going to stop here today. I hope that's been helpful information on the sources of pelvic inflammatory disease, PID, the potential symptoms one may have, and the signs that we look for. I'll be back at the next presentation for PID, the conclusion, part 3. Thank you for joining me here at GYN Corner. Please hit the like button and please hit the subscribe or follow button to get heads up on presentations and when they're coming. Please place comments to let me know what you enjoy hearing, any questions you have or topics you'd like for me to address. Anything related for women is fair game. And please check out the YouTube channel. It's also GYN Corner. Hit the like and follow buttons. And if you have a commute or you work from home, you like listening to the radio, podcasts are private radio station, so check out our podcast. It's GYN Corner. Please place a review on Apple iTunes. Let others know what it's about, what you enjoy about GYN Corner, what you like, especially that's been presented, so others can know about us and check us out. Thanks again. I hope you have a great rest of your Tuesday. I'll be back at the next presentation on PID, the conclusion. Bye!